Hi, this is Patty Hodge, and this is Dr. Nurses Rock. And this video is part of a series on grief that's happening throughout the month of April. Today, I have a special guest. Dr. Lynn Karjala is a licensed psychologist and coach in private practice in Roswell, Georgia. In addition to her general practice, she has specialized training and extensive clinical experience in the treatment of trauma in all of its forms. She also trains other clinicians in the use of both conventional and innovative approaches to therapy and has given many presentations on these topics in the US and the UK and in Canada. Before going into clinical practice, she was a university professor teaching graduate and undergraduate courses on child, adolescent, and lifespan development and the psychology of death and dying. So welcome, Lynn.
Thank you so much. Thank you for having me.
I'm so glad that you came to be with us today. And I know that what you're going to share today is going to help a lot of people. So thank you so much. I'm very grateful to you.
My
So
pleasure.
today's topic is prolonged grief disorder. So for the sake of people that never heard that term, could you tell us what that is?
Yes, I'm happy to. And actually, it's relatively new. It was only added to the diagnostic manual in 2022. So it's no surprise if people haven't heard of it.
Yes.
As it's described, it's intended to apply to intense grief that is severe enough to be disabling. And the grief also has to have lasted beyond what would be expected in that person's cultural or religious milieu. Because, different cultures, of course, have different expectations about how long grief is likely to last.
Right. So are we saying that grief is a disorder?
That's what the diagnosis implies. And I take a rather different
Well,
approach.
let's talk about that. There's an upside to having a diagnosis. So what would
Yes.
that be?
Well, on a purely practical level, the having a diagnosis that is officially recognized in the diagnostic manual means that it's likely to be covered by insurance. And for a lot of us, that's a really important consideration.
Yes.
It also acknowledges that grief doesn't follow the same path for everyone. And some people have a much harder time processing their grief.
So that's the upside. What's the
Mhm.
downside?
Well, one thing, as I read the description in the manual, uh, prolonged grief disorder can only apply to the death of a person.
Okay.
And that's not my experience at all. Imagine that your whole family has been out to the movies and you come home and your house is burned down.
Yes.
So no people were harmed, but your entire life collection is gone. And that too can be a profound source of grief. So I don't like the fact that it's just limited to losing a person. Beyond that, people might not particularly think about this, but grief can be a difficult issue for clinicians too.
Yes.
So they may have unresolved grief themselves, or it may be just that they're not comfortable dealing with these kinds of feelings. When we're uncomfortable, when we're unsure, we tend to simplify. And that's what I think this diagnosis does. It pigeonholes people into a dichotomy. It's either yes or no. You have this or you don't have this. And the, the older version of this same kind of thinking decades ago was a distinction between what was considered normal grief and abnormal or morbid grief.
Right.
Imagine being stuck with that term.
I can't imagine. So what are some alternative ways that we can describe grief?
What I prefer is to think of grief as being on a continuum. And the way we can do that is to talk about, instead of talking about normal or morbid, or yes or no, you have this disorder or
Right.
you don't, you can think in terms of complicated or uncomplicated grief. And that is a continuum. So it's fairly uncomplicated, or it could be sort of in the middle, or it could be extremely complicated. Um, and one of the advantages of this point of view is that it allows clinicians to tailor their treatment approach um, depending on what particular factors are affecting that person.
And so I am a clinician as well, and um, sometimes it would be very hard to distinguish this kind of morbid or whatever this word is now, this complicating thing, this prolonged grief with
Mhm,
depressive symptoms, because apparently this diagnosis says something about it has to affect your ability to function in some
mhm.
way. Yeah. So, so what are some of the complicating factors? Did we go over
Yeah,
any of those?
yes, there are actually dozens of
Okay.
possible complications, and that's why I think it's most useful to think on a continuum, because you can have relatively few of these,
Right.
none of them, or you can have an enormous pile of them. Some of them are really obvious. Anybody would guess them. Um, if the death was sudden, for example, so you didn't have any time to prepare. If the death was untimely,
Right.
if a person younger than you, especially a child, dies. So, and of course, uh, a death from suicide, or any form that in which you could blame yourself somehow. So all of those are pretty obvious complicating
Yes.
factors, but there are some that we don't always think about. One is already having unresolved grief from something else.
Yes.
So the more deaths or losses you have in a period of time, the more likely you are to have great difficulty processing any of it.
That's a compounding grief.
Yes,
And so people can have multiple losses before this major traumatic loss. And if that wasn't resolved or dealt with appropriately in some way,
right.
then this other loss happens to tip them over the edge, basically, into this prolonged disorder.
Okay. And as I said, there are some factors so there's some that are obvious. There are some that are not so obvious, not things that you wouldn't particularly think of. For example, if there's been a car accident and one person has died, the other survived but is in the hospital for weeks, they're unable to participate in the normal grief rituals. So when they get out of the hospital, everybody else has moved on. So they're completely out of step with their entire support group. And oftentimes, of course, those people don't want to talk about it anymore. They don't want to listen. They don't want to process. So that can make grief much, much more difficult. And another one, again, we know about, but we don't always think of, is when the person who has died has extracted a promise from the survivor to not be sad, not grieve, move on, because that doesn't give you permission
Right.
to process your feelings, to grieve. So there are many, many different kinds of factors that can enter in.
Exactly. And it's a good thing we have skilled clinicians like you to know what to do. So what is it that you're looking for, and what is it when this grief is so complicated and difficult and you see a client? What are you looking for?
The main thing is that as I listen to the person, and as I listen to them explaining what's going on for them, what are all of the different thoughts and feelings that they have around this death. And of course, some of those are very difficult to express. sometimes we feel relieved
Yes.
after a prolonged illness. So some of these feelings are difficult to acknowledge. But as I listen to these various different kinds of feelings and events, then I can begin to work on each one of those factors individually. So we can talk about it if, classic example, if the last thing they said to the person before they left home was an argument. So we can work on the guilt about that. If they had an ambivalent relationship with the person, we can tease that apart and look at what was good and what was difficult in the relationship. So we can look at all of the different factors individually.
Talk to me a little bit about what might slow that down. Is there there's something that I hear here about listening,
Mhm.
and you're listening for specific things coming from people when they talk to you, so you know what to address for sure. Is there
Mhm.
something internal happening with these folks that might be getting in the way?
Yes, indeed. Um, a major, a major complicating factor is often the inner critical voice.
Okay.
The inner critical voice is that naggy, negative, judgy part of ourselves. And pretty much all of us have that. So every time you hear yourself say, "Oh, how could I be so stupid or clumsy or blind?" That's your critical voice talking.
Right.
So we may not realize that we have this, but it's there and it's making mischief. Uh, Sometimes actually you don't hear it in words. Sometimes you experience it just as a wash of feeling that would typically be guilt or shame or embarrassment. So
Yeah.
again, anytime you're feeling those kinds of things, your critical voice is at work. Um, my work goes into a lot more detail about this, but there are three really essential things to know about your inner critical voice. One is that we created in early childhood to be a protector. Another is that it's born out of trauma, and it doesn't have to be a fire, flood, destruction kind of trauma.
Yeah.
There are what I call everyday traumas too. I think the first time a child hears no, no, especially if that's then backed up with some kind of consequence, that's actually a world changer.
Right.
Typically an infant doesn't hear anything like that. They just, they need to be fed, they need to be changed. That happens. But when the toddler starts to get mobile, we say no, no, a lot. And again, we start applying consequences to that. So the child's worldview now has completely changed, and they may feel that they need a protector to save them from being scolded or having a toy taken away or anything like that. And the third thing is that because we created in early childhood, it actually and it doesn't grow up from there. It actually has all of the normal developmental characteristics of a 4-year-old child.
Right.
Oftentimes when we're thinking about the critical voice, we think of it as 10 feet tall in a black cloak and looming over us and all powerful. It's not. It's a child.
So when this person that approaches you and says, "Listen, I need help. I can't get past this loss, whatever this loss is." And even if the DSM says it's just a death of someone, but we know that it might be something else. Um, when they come to you and you start to listen to them and you hear this little 4-year-old peeking out in their conversations, well, how do you address that? How do you deal with that?
I start by explaining what the critical voice is and how it operates, and especially again, knowing that because it's a child, we can deal with it as a child. We can, just the same way that you would talk to or deal with an external 4-year-old, you can use the same kinds of techniques, the same kinds of consequences for the critical voice as well.
Okay. Well, I'm certainly thinking about this prolonged grief disorder in a different way, having heard these explanations from you. I do want to tell people that you do talk about this in your book, which I have here, which is in back of you. This is called Healing Everyday Traumas by Lynn Mary Karjala, PhD. And I got this on Amazon, so I'll be sure to put a link below for your book and for a way for people to reach you if they have questions about everything that you've talked about today. Is there something I should have asked you that you think we could address and move a little more of the world, make the world a little more happy for people and experiencing grief in some way?
Well, yeah, a couple of things. One is um, we can do a small exercise if you're up for this
I'm up.
that will help people begin to deal with the critical voice. This is a starting point for beginning to deal with it.
Great.
Okay. This is an imagery exercise. So I'd like to invite people to just get comfortable and uh, you just kind of settle in, sitting or standing. You can keep your eyes open or close them, whatever is better for you, whatever is most comfortable. And take a few breaths just to kind of settle in. And now, in your mind's eye, scan your physical body to find where the critical voice is expressing. You may find it in your heart or your brain, in your shoulders or your neck, your heart, your gut, or any other part of your body. You may feel it as tension or strain or stress or pain or numbness or some other sensation. Once you have located the critical voice in your body, bring your attention to it. Direct it to give you some space. And just as you would with a child, be authoritative in your tone, pleasant and firm at the same time. So don't be overly soft, but don't bark orders at it either. So, for example, you can tell your critical voice that you are in charge. One of the things I most like to say to my critical voice is, thank you. I know that you're trying to help, and I've got this. Then you can direct it firmly to go sit in a chair well away from you, or even in the next room. You might even have a specific place for it that's surrounded by golden light and designated as a timeout area. And one other point, because our critical voice listens to our subconscious processing as well as our conscious mind, sometimes on a conscious level, we are saying, now go sit over there. And on a subconscious level, we're saying, help, don't leave me. So there's a way to fix that too. You can, if necessary, you can say, regardless of what you think you hear me say to the contrary, follow my spoken directive. That requires the critical voice then to focus on what you told it consciously to do, to go in the other room instead of sticking around and trying to help in its um, very unhelpful way. And if you've had your eyes closed, then when you're ready, you can open your eyes and come on back.
Well, thank you. That was an interesting experience. Now I know how to handle that little 4-year-old. Do you have any idea about what people should be looking for resources, in particular related to this topic?
Yes, I do. Um, there, of course, are probably thousands of books and articles and so on, and anybody can pick those up on Google.
Yeah.
So rather than recommend a specific book or a specific program, instead, I'd like to share some thoughts about what to look out for in these resources.
Right.
What are some red flags that tell you that maybe this isn't the most helpful place? One is if you find that people are engaged in rather rigid thinking, because of course that reflects the critical voice, the 4-year-old level of thinking. It's very rigid and black and white. And one way that shows up in a lot of these resources is the belief that people grieve or die in stages. That's just not true.
Right.
That research was debunked a long, long time ago because in a stage theory, you're in one stage and then you complete that and you go to the next stage and you never go backwards. You always move upwards. That's not the way people grieve. If you read something about these so-called stages, the far better way to think about it is that these are common emotional reactions, and you can go back and forth among them. Um, the first reaction might be denial, but then you go to anger, and then you go back to, then you go to barking, and so you may go in many different directions. And you know, some people are already ready to accept the death. So they are still grieving, but they don't go through any of the rest of that.
Right.
So if you find that someone is kind of rigidly stuck in that kind of thinking, I would look for a different resource. And another one that I was aware of here in the Atlanta area was a particular grief group, and I'm not going to mention whose it was, but um, I stopped recommending them to my patients. And the reason was that the leader of the group had been there for 17 years. And what I was hearing from people was not that she had reached her own healing and then so wanted to support other people through it. What I was hearing was that she was stuck in the identity of I am a grieving survivor. And that does not help other people to work their way through the process.
I see.
If I may, let me give you one specific example from a long time ago. After 9/11, some very well-meaning people set up a summer camp for the children who had lost parents in the 9/11 attack. That was lovely. That was fine. But this camp was still going on 5 years later. And what that means is that the adults had not processed their grief.
I see.
They hadn't moved on. And so they were they were pushing the children into this identity of, oh, I'm an orphan of, an orphan survivor of, and that's not, they were not letting the children move on.
I see.
and build a more comprehensive identity, that being only one aspect of it. So watch out for people who are stuck and are not actually moving on in their process.
So, one of the goals of this channel is to encourage people to build their tribe. And
Yes,
so we're asking people to be careful about who they let into their inner circle and to be aware that people are here to uplift you and move you forward and help you live a healthy, happy life.
that's excellent. Yes,
Very good. Thank you so much. Hopefully, we'll see you soon. Thank you, Doctor.
it's been my pleasure. Thank you so much for having me. And I'd love to come back.
Thank you so much. Bye for now.
Bye for now.